Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you're studying for the NPTE, check us out at sptwithme.com for our prep courses. Now for what you're actually here for, let's talk about the olfactory nerve, cranial nerve 1. Whenever you're studying for the cranial nerves, this is probably the image that comes into your brain immediately. So if we look at where to find cranial nerve 1, wait a second. There is no cranial nerve 1 on here. That's because it actually does not come into or out of the brainstem at all. It actually enters the brain directly through the forebrain. So the reason I bring this up is because even though this image of the anterior to posterior view of the thalamus and the brainstem is, again, the first thing that pops up into your brain, it's not always the case. It's not always 100%, yes, this is exactly what I need to have memorized for the cranial nerves, because clearly it's not even associated with cranial nerve 1. So just keep that in mind. All right, so here's a different view of the brainstem and thalamus. It's the posterior to anterior view, right? This is the back side. So let's go ahead and find the olfactory nerve. But wait, no, it doesn't enter here. Remember, it enters the forebrain. So of course you're not going to find it over here. Yep, next image. Okay, now it's actually time to talk about it. So let's look at how this nerve travels. So you look at this picture, you're looking at a side view of a person with their nose to the left and the back of their head to the right of the screen. Sensory receptors, these begin at the cribriform plate of the ethmoid bone. Sensory receptors pick up information. They send it within the olfactory bulb, which then sends that information along a tract, meaning an axon, to the forebrain. It's going to eventually reach the primary olfactory cortex, which is in the temporal lobe. So this is another angle that you can consider when you're studying this nerve. If you look closely at it, you're going to see that the olfactory nerve does not enter through any part of the brainstem, but instead it directly enters through the cerebrum. Of course, also note that this is an angle of the brain that you can see. It's not telling the whole story. It almost looks like the olfactory nerve goes superiorly, when in fact it goes ventrally, it goes forward. So just keep this in mind when you're looking at pictures. You always want more than one picture to show its actual orientation and a three-dimensional location. In this image, look at the purple and light orange colored areas. These are the associated areas of where the information from the nerve goes to. We're talking about the brain. The brain is what interprets smell. So you're going to see the orbital frontal olfactory area, the primary olfactory cortex, olfactory bulb, the tract, you see the sulcus. So let's talk about its function. This is a purely sensory cranial nerve. It does not do anything motor. I want to touch on this because when you talk about nerves in general, you want to know if they're ascending or you want to know if they're descending. Ascending meaning they're sensory and they're receiving information from somewhere, then sending it to the brain for interpretation and registering. What happens after that is that hopefully the brain is going to register it and then tell the body to induce a motor response, but of course only if that is necessary. This nerve in particular has nothing to do with a motor response, right? So let's say you're smelling something rancid. You might have a motor response to, quickly back away because it smells that bad. This is the nerve that tells the brain that there is a rancid scent, or at least it just tells the brain that there is a scent. Then when the brain gets that information, the brain is going to determine what that means. It's going to say, woo, that smells bad, or, maybe it smells good. I don't have to do anything. But in this case, if something smells rancid, the brain can then send a motor response through a different nerve, a motor nerve. Then that induces the, ooh, let me back away, a motor response. So whenever you think about cranial nerves, or really any nerve for that matter, think about the direction. So in the case of a sensory nerve, it's going to go distal to proximal, right? It's going to go distal, the nose, then proximal, meaning going to the brain. So it's entering the brain with information rather than exiting the brain with information. Now let's talk about its function. The olfactory nerve performs olfaction. It gives us the ability to sense smells. Now let's talk about how to test it. As a physical therapist, so even without looking and what's on the screen, if I'm telling you that a cranial nerve provides you with the ability to smell, doesn't it just make sense that if a person can't smell something, that could potentially mean that the olfactory nerve isn't working? That's exactly what the test is. So what you can do is have your patient sitting or standing, really doesn't matter. You have them close one nostril at a time, and you give that person a familiar scent. You're not just going to give a random scent from a hotel that you enjoy. Let's say something that everyone knows, menthol. Now, of course, if a person cannot smell something, does that necessarily mean that there is 100% something neurologically wrong with cranial nerve 1? I would say no. For example, I catch the flu and I'm snotty and I have a runny nose and my sinuses are impacted. I can't smell anything because my sinuses are blocked. That doesn't mean that I need to go running to the doctor and say that there's something wrong with cranial nerve 1. There are other things that could potentially be the reason for a positive result. Now, there are some things that if there is not another potential reason for not being able to smell, a positive test can suggest. So for instance, if a person cannot smell due to something going on with the olfactory nerve, it could be a sign of Parkinson's disease, Alzheimer's disease. Furthermore, if you find out that a person can't smell very well, that's also something to be considerate of because it's a safety hazard. What if there's a gas leak or a patient can't smell something that's burning? I mean, these are things that you have to bring up and at least maybe try to get them a little bit more information of how to address this loss of scent because it could be a safety hazard. Hopefully this helped with understanding the olfactory nerve a little bit better. Check out sptwithme.com when you're studying for the NPTE. Check out these references if you like.